Hi everybody, welcome back to Talk with TQ and the Energy Stoners Cafe. We're going to have Dr. Cedrick on again because we want to talk today about digestion. Very important, you got to digest. You don't want to have indigestion. It's good to have digestion, and we're going to learn how to make it work more smoothly. So, Dr. Ced, here we are again.
Hello, Toni.
So, the digestive system, where does it begin?
Great question, and thank you for having me on once again. So when we talk about the digestive system, we're really talking about a series of organs in the body. It really begins in your mouth and ends in your anus, rectum area. Everything in between is one continuous tube. So that includes your mouth, that includes your esophagus, that includes your stomach, that includes your intestines, both small and large intestine, and of course that includes the rectum. So that's one continuous tube. Interestingly enough, when something is within that tube, even though to you and I, it seems like it's inside the body, it's actually considered still outside of the body, even though it's inside of us, because the gut is its own tube. And so what happens around the gut is considered the body, right? But when something is in the gut, or when something is in your digestive tract, it is still considered out of the body in a way, even though it's inside of you. So I thought that was interesting to share.
It is interesting. And then the other thing is, as I've heard and I've learned, that the gut is very important to brain health. I've heard the statement made, gut health is brain health, and without gut health, you cannot have a healthy brain. Now, I don't know if that's 100% true. What's the real deal on that?
Yeah, great point. So the gut is often touted as being the second brain. And just to put into perspective, your body has about 30 trillion cells. Okay, that's trillion with a T. Within your gut, you have about 40 to 100 trillion microbes. Okay, I want to distinguish between your cells and the microbes. You have between 40 to 100 trillion microbes within your gut. So we call it the gut microbiome. So it's a whole world in and of itself. And so when you look at that, you ask yourself, why do we have all of these microbes, or what people typically call germs? Why do we have them just sitting, living within us? Well, that's because we have what's called a mutualistic relationship with a lot of these microbes. So they break down into about 1,000 different species, and each species has something that it focuses on, that it's good at. And so I like to think about it like this. You have good bacteria, you have bad bacteria, okay? You have harmful agents such as viruses and compounds that will try to get in and get into your bloodstream and cause all sorts of trouble. What tends to happen is this: the way in which something will get inside of your bloodstream, right? Remember, the life of the body is in the blood. The way in which something can get into the bloodstream is one of two. There are two ways in which a harmful compound or a harmful agent can get into your bloodstream. Number one, it can get into your bloodstream by injection, which is physically puncturing your skin and getting access into your blood. Or number two, through ingestion, which is you eat it or you drink it, and as it's going along your digestive tract, at some point along your intestine, it gets absorbed into the bloodstream. Now, what's interesting about that is you've got all of these trillions of microbes inside, having colonized your gut. And one of the things that they do is they offer benefits to us. I like to think about it like, have you ever seen a shark underwater and the shark is swimming, but then you've got all these small fish that are swimming along with the shark? They're right next to the shark. They have what's called a mutual relationship. So a lot of times these small fish, they call them minnows, I believe, they're swimming with the shark and they're not afraid that the shark's going to eat them. It's not going to get much meat out of them. But what they do is when the shark grabs onto something and shreds it and shakes the meat, chunks, small bits and pieces come off of it. And so these minnows, that's their food, right? And I believe they have a benefit to the shark by helping clean its teeth. Shark's not going to eat them. So they're able to eat the bits and pieces that are along the shark's teeth, and, free dental process, right? Free dentist procedure. So it's a mutual relationship. So the shark does them a favor and they do the shark a favor. Well, those trillions of microbes that are in our gut also have a mutual relationship with us. They help us, for example, produce certain vitamins, vitamins B and vitamin K. We can't do that, and we don't often obtain them enough of them from food, so the body is able to produce them. Well, these microbes are able to produce them. They can help further break down foods. And to your question, as far as being the second brain, there are more nerve endings connecting your gut to your brain than anything else. What that means is it is evident that the compounds or even the hormones that your gut produces directly affect your brain. They directly affect your mood, hence why the gut is called your second brain. If you eat crap, well, guess what? Your brain is not going to function in the way that it could, right? You're not going to have, the dopamine released like it normally should. So, but if you eat well, if you have a clean gut, a healthy gut, well, guess what? Your brain functions optimally, right? And that also ties into mental health and a lot of the depression and a lot of things that people are struggling with today.
Yeah, mental health. It's interesting. There are people that get a stomach ache when every time they get nervous, their stomach hurts. And you think it's your stomach, but it's really something happening up here.
Yeah.
The other thing is that the digestive tract is very long.
Mm-hmm.
And so it is important to eat right because I've heard that there's like miles of intestine
Yes.
that it goes through. I mean, how much distance does it go? It's traveling all through that.
Mm-hmm. Well, your intestines that's a great point, Toni. Your intestines are actually just like folded along each other, right? So it's sort of like this squiggly thing and very efficient, just compact, right? So ideally, again, it starts in your mouth. You want to be able to chew it, break it down, right? And then the addition of saliva helps, further break it down, right? Chemical digestion as well as physical or mechanical digestion. Then it goes down your esophagus and into your stomach. Now, this is really crucial because you want to make sure your stomach acid is strong. And by strong, I mean it needs to have what's called a low pH. It gets a little confusing, but low pH means you have a strong stomach acid. High pH means you have a weak stomach acid. What you want is to have a low pH, hence a strong stomach acid. You want food to hit your stomach and melt, okay? Because that is how it's able to go and enter into your gut, and the germs are able to absorb the nutrients from that, right? And so what's interesting is for those people who have a high pH or a weak stomach acid, they tend to have food sitting in their stomach for a very long time. So that slows down gastric emptying, that slows down the process of digestion. Not only that, when you have things leave your stomach and enter your gut, they are not fully digested. Well, you have things like the development of celiac disease, right? You have, for example, gluten molecule for people who eat a lot of grains, right? Wheat, barley, rye, and oats. They tend to contain a molecule called gluten. Gluten is a very strong molecule. It has a lot of chemical bonds, which makes it difficult to break. So you need strong stomach acid in order to completely break it down. But unfortunately, for many people, especially in the developed world, because of the way we eat and some of the things that we do eat, especially as we get older, our stomach acid actually gets weaker. And so whenever we're eating grains, especially refined grains, many of them contain gluten. And that molecule is not fully or completely broken down. And so by the time it enters your intestine or your gut, what actually happens is because it's not fully broken down and it's going through, it's actually scraping the cells. It's actually scraping, they call them villi. These are little tongue-like structures that will, when food passes, they'll suck the nutrients from the food and put the nutrients inside of your blood, inside of your body, and so that the waste is what ends up in your toilet, right? But when you have weak stomach acid, which means it's not breaking down things the way it should, you have things, for example, like this gluten molecule that goes along your gut undigested. And because it does that, it begins to scrape off or kill off the villi. And so that reduces your overall ability to absorb nutrients from the foods that you're eating. So you could be eating healthy, right? But due to the fact that your villi, a lot of them have been killed, they've been damaged, because of the fact that your stomach acid is weak. Okay, so it's this mechanism on top of mechanism. So the weak stomach acid, unfortunately, allows certain things to pass through. And because they're not fully broken down, they begin to kill or damage your gut. And so they kill off the villi, which are responsible for absorbing things. And because some of your villi are dead, they're not able to absorb as much nutrients from the foods that you're eating as they otherwise would. So you're missing out on nutrients. That can lead to deficiencies. And of course, these deficiencies can lead to chronic diseases. So it's this intricate web of connections throughout the body, but it starts with making sure you have strong stomach acid for digestion.
I'm imagining that if someone does not have that strong stomach acid and the food is not getting broken down, it's sitting there, it's decomposing.
Yes.
And you're rotting food in your system.
Oh, yes. I believe the statistics are that there are 60 million US adults who take some sort of proton pump inhibitor or an antacid on a weekly basis.
Proton pump inhibitor?
So these are a lot of the acid-stopping medications you see. So you can think of like Prilosec or omeprazole or pantoprazole or Protonix. Some of these things you see on TV. If you watch the evening news, you hear a lot about, hey, if you're having heartburn, if you're having acid reflux, take this drug, right? And so it's gonna help turn off the acid. But what's actually happening is that when food sits in your stomach and it's not being broken down, remember you have germs or microbes in your stomach, notably one called H. pylori. H. pylori actually, when you have especially sweets, carbs, because germs love sugar. When you have sweets just sitting in your stomach, they grow and multiply like you can't even imagine because they're feeding off of it. And so as they're breaking down and feeding off of it and multiplying, guess what? They're releasing their gas, okay? So this gas pressure is what you feel along your esophagus, and it can lead to acid reflux or heartburn. So that's why when someone has heartburn, they generally have the belching symptoms or they're burping, and you kind of smell and that there's acid in their voice or in their breath. That's really a result of the unfortunately people have the misunderstanding that you're producing too much acid. That's actually not completely true. The reason you're producing too much acid is because what acid has been produced is not doing the job. So the body is producing more in hopes that it will further break down the food. But ideally, if your acid was strong enough, your body would not produce more. It would be strong enough to break down whatever happened. So it is not necessarily too much acid that is creating the symptoms of heartburn, but rather it is the fact that your acid is weak. And so it allows germs to proliferate. And as they're proliferating and they're fermenting and eating, many times they're sweets, right? Eating whatever it is that you ate. And as they're eating it, they're producing gas, which is giving you heartburn, which is causing you to belch, which is causing all of these things along your esophagus, right? The redness, the pain, all of this thing. And so unfortunately, what we often tell people is just take a pill and stop this, stop the acid, take an acid blocker. And that's not necessarily a good thing. What we should do rather is telling people instead to, hey, work on getting your pH from being high to low, or from having weak stomach acid to strong stomach acid. I think if we did that, we would do away with a lot of symptoms of acid reflux and heartburn and GERD.
So often they don't go to what the real cause of things are. There's esophageal cancer, just to sort of stay on the topic, digress a bit. And I've known someone very close to me who died of esophageal cancer. In retrospect, I can say that he belched a lot. He had like that and flatulence, always distress, always distress. And I imagine he was having problems with that process that we're talking about. Took antacids, was given those drugs, by physicians, and it kind of masked the symptoms, but the cancer kept growing, and he died.
Yeah, it's an unfortunate thing, and condolences to you and your friend's family. Yeah, so it comes down to the idea why I wrote the book, Self-Care Advocates, 7 Steps to Prevent Chronic Disease. The conversation about chronic disease prevention is not always had. It's not actually something that is common, unfortunately. I think that we have gotten used to treating the symptoms. And so our whole system of healthcare, unfortunately, focuses on just treating the symptoms. But when you look at where we are, 85 to 90% of what we're spending is on chronic diseases. So the idea of treating the symptom is not working because we're spending the bulk of our money just treating the same things over and over and over again. So if we took a different approach and focused on chronic disease prevention, finding out those tips, those strategies that would actually do away with the problem, I feel that we would save a lot more money, right? We'd free up the healthcare system. We'd be able to cover more people. I believe it would be a better system overall. But until then, my message is for people to become self-care advocates and not just look for that which will mask their symptom, be it a drug or something, but actually seek to understand the bodies they've been given by their creator. Okay, you've been given this amazing body, and it adapts and it works and it tries to save you and preserve you. But unfortunately, because we don't take the time to understand our bodies, we just offload that responsibility to somebody else. Things like this tend to happen where someone is struggling with acid reflux or heartburn, and they're given an acid blocking medication. Well, unfortunately, acid blockers have other side effects that can tie into the inability to absorb nutrients, right? And that also contributes to the development of various chronic diseases. So unfortunately, I think this idea that you can stop or deal with the symptoms and you'll be fine has unfortunately been falsely adopted, because every drug out there has side effects. We don't like to talk about it, but if you're taking a drug, you may want to take a look at the list of side effects. And I think that's going to motivate you to try to become a self-care advocate and take a holistic approach to things while you're taking that pill.
Yeah, let's hope. It's hard to know. It's funny when you talk about the mechanism of the body and you start thinking, I got a body, I have a body, I have one of those. And you start to sort of, at least me, start to picture like what's going on in there.
Yeah.
And, really even the accumulation of eating, of getting overweight, becoming overweight, it manifests on the outside, but in fact, the fat is all in between your organs.
Yes.
I think it's really important to be able to have a good metabolism. It sounds like it starts with good digestion.
Oh, yeah. No, it absolutely does. I think that when we talk about good digestion, we have to take a look, get a magnifying glass and take a look at the gut, right? And just even before the gut, look at your stomach acid. You want to make sure that you have strong stomach acid. The older we become, the weaker our stomach acid becomes. And so especially for those who are more seasoned among us, should really be making sure that they're testing or talking with their physicians to make sure that, hey, what is the state of my stomach acid? Can we test the pH of the stomach acid and see where it stands? Because that'll tell you whether the process of digestion is actually working well for you or not, rather than you finding out when you've got some sort of disease.
Now, this stomach growling, my stomach happens to be growling right now. So that most people think when your stomach growls, you're hungry. Is that what it means?
Well, that's a good point. Well, yeah,
I don't feel hungry, but...
Well, it typically means, yeah, that, there's room for more. But it can also be a process of digestion that's just taking place within it. So, because remember, the stomach is this furnace full of chemical reactions. There's always something going on, right? You think about if you ever go to like a blacksmith or something, they've got like a fiery furnace and they're throwing metals in there and they're taking it out and they're banging it. Well, that's a lot like what's happening inside of each of us. You've got all these reactions taking place within your stomach. So you're bound to have noises, you're bound to have, reactions, you're bound to have grumblings, right? Depending on whether the type of food that's in there. Maybe you don't have any food and the body is just trying to clear what's left over into the intestines to let you know.
Something's moving.
Yeah, to let you know, hey, we're ready for the next batch.
That's interesting. Yeah. It is to me. I just think that if people really understood, what's really happening, they'd change. I wonder if you ever discuss or think about or work with children. I think children need to get counseling or get some knowledge about what goes on with their body and learn self-advocacy with their health. But I know when a person is young, they often think that they're indestructible.
Yeah.
Even if they're 30 pounds overweight, they don't think anything will ever happen to them. When in fact, what I've noticed is the incidence of childhood obesity. I was an obese child, but I got over it. But not everybody's trying to get over it.
Yes.
So what would you suggest? Like, how could parents help?
That's a good point. So I look at it like this. It's kind of like buying a new phone. One of the first things you're going to do is when you open up, you do the unboxing, you're going to read not everybody reads the instruction, but if you've gotten a new phone, let's say you're switching from Samsung to Apple or vice versa, you want to look at the instruction manual. And you want to look at the instruction manual because you're not familiar with how to use this phone. You're not familiar with the settings. You want to know the basics of this phone, right? To see how it works. Well, likewise, if you were to purchase a car, right? You want to know, okay, what does this mean? When this light on the dashboard turns on, what does it mean? Does it mean I have to get an oil change? So you want to know basic things. What happens if the car makes this noise, right? What happens if I do this and the car does that? You want to know those basic things because that will tell you need to take this appropriate step in order to resolve that problem. The problem is we have something far more valuable than a phone, far more valuable than a car. We have the human body. And for many of us, we simply take it for granted. We don't take the time to say, well, what does this mean? Okay, well, my mouth is dry. Does it just mean I need water? Can I give it Coca-Cola? Can I give it a beverage? We don't take the time to learn what our bodies mean. And in many ways, we offset that responsibility to a physician. And though they can be helpful, ultimately, you are responsible for your body. Because just like I can tell you, I'm sorry that you're feeling hurt or that you're in pain, I'll pray for you. At the end of the day, you're the one that's in pain, right?
Yeah.
Though my sentiments and feelings for you are generous and are genuine, and I do want you to feel better, you're the one that's in pain. So I think it's incumbent that each of us take a moment to study our bodies, to understand our bodies. If you do not desire a particular outcome, well, find out what is causing that outcome and then be proactive about it. Essentially, that's what I call become a self-care advocate. It's not about asking your doctor every little thing, right? You see the doctor once, maybe twice a year. It's not about waiting then and then asking them every little thing, but it's about saying, well, what does this mean? Or how do I improve this? It's about being a willing participant in your care, in your health, in your wellness. It's about taking time, just like we read magazines and we read books and we watch movies and we know all these things about all these things that are not as important, right? We should take some time and study our bodies, see what we're reacting to. And ultimately, that's going to make you an advocate in front of your doctor, along with your doctor. It's going to make you a willing participant in your care.
Yes.
And that is crucial.
Yeah, participating in your own health care. This is a magnificent machine that we all walk around with.
Yes.
And it's complex. And I think that oftentimes we just surrender to whatever the doctor says. I don't have anything against doctors, but what happens, I would imagine, then you get really, really sick and all of a sudden it becomes more important to you than it was before you got sick.
Yes.
And then you're almost forced to surrender to whatever is given to you, the drugs, everything, without really knowing, because pain is very motivating.
Yes.
It'll get you to do things just to get rid of the pain. But I guess the objective is to not have to deal with the pain. And I think that from reading the book and talking to you, realizing that a lot of stuff has to do, a lot of the issues with your body have to do with your behavior towards your environment,
Yes.
your behavior around food, and often it's hard to face facts. You got me thinking about a lot of things, a lot of people that I love, and I'd say often it's easier said than done, but once you start and you get used to that lifestyle, it becomes a natural response as opposed to the unhealthy response.
Yes. Yes.
Yeah, so any closing words for the audience about digestion?
Yeah, no, I appreciate the opportunity, Toni. With regards to digestion, I want to say it's very important for people to understand that you need strong acid. And I mentioned it in a previous interview, the importance of water and salt. And though people are afraid because salt has a negative stigma, I want you to consider something like sea salt or even kosher salt. The hydrogen chloride the hydrogen comes from H2O, the chloride comes from sodium chloride. So that's hydrochloric acid, HCl. And so you need adequate amounts of water as well as some salt in order to make sure your stomach acid is strong. You can also get digestive enzymes such as pepsin, and I believe hydrochloric acid enzyme tablets are available as well. So those can also help your stomach acid lower its pH, which means it's stronger. And that's going to be crucial in order to break things down, break foods down, along with digestive enzymes such as amylase and some of the other ones, pepsinogen, which will help break down meats, proteins, carbs, and fats. So that's crucial. But when it gets into your gut, when it gets to your small intestines, if you want to maintain your gut, you want it to work for you, I think one of the best things you can do is maintain or increase the diversity. I stated earlier, you have about 1,000 different species of microbes in your gut. Increasing that diversity actually works to your advantage because they will outcompete any harmful agent, harmful bacteria or harmful virus that tries to colonize. So they won't allow it to. They'll fight it off, right? So you want greater diversity. So how do you get that? Well, by eating more diverse foods and fruits, by making sure that you're getting prebiotics. Okay, these are foods that actually feed those germs. By making sure you're getting probiotics. If you can't eat a diet that provides you probiotics, such as by consuming things such as sauerkraut, kimchi, fermented foods, well, fortunately for you, there are many supplements out there that will provide probiotics in your diet. Now, ideally, you want something that provides live probiotics, okay? Or that is whole food or food-based, not some of the synthetic things out there. But if you can do that, I think you're well on your way to improving your gut health. And of course, the gut ties into every other aspect of your life and your health.
That's right. So there you have it. Eat right, fermented foods. I'm having a craving for kimchi. I have to find where I can get it around here. I love it.
Yeah.
And sauerkraut. So if you're gonna eat the hot dog, do the sauerkraut too. It's good for you. Anyway, thank you so much for being on the show.
Thank you,
Once
Toni.
again, we're going to have you on one more time at least, because there's always something else to discuss about this great book, The 7 Steps to Prevent Chronic Disease.
Yes.
It's all about self-advocacy. You have to advocate for your own health, and you can do it. So I'm going to say thank you again to Dr. Ced, and thank you to the audience for coming to listen to the Energy Stoners Cafe and Talk with TQ. I'll see you next time. Be well. Bye-bye.